Welcome to Elevate Pod, where we elevate your mindset, inspire your spirit, and ignite your leadership journey. This podcast is brought to you by Elevate Leadership Services. My name is Bro.
And I'm Chiwechungo.
We are the co-founders of Elevate Leadership Services and the hosts of Elevate Pod. The Elevate Pod is dedicated to inspiring and empowering listeners with a focus on minorities and immigrants. We offer tools, resources, and pathways to foster personal and professional development.
And today we are really honored to interview Dr. Linda Jackson, who will share her journey, experiences, her thoughts on a lifetime of care, dentistry leadership, and the power of service. Leadership in healthcare begins with compassion and grows through service. Behind every health smile is care, dedication, and trust. In this episode today, we explore how dentistry goes beyond procedures, combining clinical skill, leadership, and empathy to restore confidence and relieve pain. Hear from a practitioner, a mentor, a leader, and a person who has led teams and who have put patients first and who show how small acts of care create lasting impact. Whether today you're listening as a clinician, whether you're listening as a patient or a seeker of meaningful work or career, this conversation celebrates service, celebrates purpose, ensures that you know what transformation is, and gives you the information that you need. But before we dive into discussions and conversations that we're going to have with Dr. Linda Jackson, I would like to give you her short bio that she shared with us. Dr. Linda Jackson is a retired dentist. She's a mother and a grandmother. And she's very proud of those two roles, the mother and grandmother. She worked for 21 years as a commissioned officer with the United States Public Health Service. She served on Indian reservations and in communities across the United States, including Oklahoma, Michigan, Arizona, New Mexico, and Minnesota. Imagine. Of the 50, she did cover 5 states. She provided direct patient care and managed the day-to-day operations of dental programs where she served. After retiring from the U.S. Public Health Service, she became an adjunct associate professor at the University of Minnesota School of Dentistry, where she taught clinical dentistry to dental therapy, and dental hygiene students in their final year of study. The community clinic located in Wilmer, Minnesota served low-income patients from 17 surrounding counties. After retiring from the University of Minnesota School of Dentistry, she moved to Colorado, where she spends her time daily working and providing daycare for her 2 young granddaughters that she admires a lot. Dr. Jackson, do you have anything that you'd like to add to your bio?
I think you covered it pretty well, Chiwe. Yeah, so my career in dentistry was a little different than most people realize because instead of having my own private practice, I worked for the government. And for me, I really enjoyed that aspect because I not only got to work with the individual patient, I also got to work with communities and try to make an impact in improving the health of the community in which I served.
That is what we need, the impact and community you serve. Yay! All right. Thank you. Over to you, Pearl.
A smile can change someone's confidence, health, and even their future. The professionals behind those smiles carry a bigger mission: leadership, service, and a lifelong care. Today, we're diving into the powerful role of dentistry, the role it plays in shaping healthier communities. I can't wait to hear more about it. So, Dr. Jackson, let's get into it. What originally inspired you to pursue a career in dentistry? And was there a particular experience, a mentor, or a moment that made you realize that this was the path you wanted to dedicate your life to?
Yes, I had both of my parents worked in healthcare. Both were nurses, and my father was part-time and LPN, and my mom was a registered nurse. And so that kind of got me interested in healthcare in general. And I became fascinated with dentistry in particular because my parents took us to a African American dentist in inner city Chicago. Um, and I just really, I don't know, looked up to him and admired him. He made, as a patient, as a young child, as a patient in a dental chair, I really felt at ease. Sometimes it can be intimidating, but I really liked how he treated me in particular as a patient. And I also found out that his daughter went to dental school as well. And so then it was kind of like, I think I could do that. And so that was my first introduction into dentistry, and I kept following up on it because that was something I was really interested in doing.
Oh, you know, people can make a difference in our lives. And each one of us, somebody has served. I became a breeder because of the leader that I saved. And yes, he made me want to become just like him. Like what you said, that dentist was not just doing his job, but he was making sure that you were comfortable and also showed that you can be it. And you admired him and you became one.
Mhm.
And I'm sure you wanted to live by what he did as well because
Right.
you had a mentor, indirect mentor. That's perfect. That's wonderful.
And it was interesting too because as I went through school and my lower education,
Mhm,
and would tell people I want to be a dentist,
mhm,
and I even went to some summer programs that were designed to help people that were interested in healthcare,
mhm,
and everyone kept trying to get me to switch to medicine.
mhm. Okay.
And I was like, no, that's not what I want to do. I really feel drawn to dentistry. And another aspect about dentistry is you work with your hands quite a bit, and that was something I enjoyed doing as well. Doing a lot of arts and crafts. I knit, I sewed, crocheted, those type of things, and so I just felt like I would not only be in a healthcare profession helping people, but I would also be able to work with my hands, which is something I enjoy doing.
Wonderful. Followed your passion.
Right.
Yeah. Yeah. And many of us, but I'm not saying many people, I'm saying many of us because I'm one of them. Many of us, we think that dentistry is purely clinical, but it involves deeper human connection. I think you mentioned it in your introduction of why you became a dentist. When did you first realize that dentistry is really about caring for people, not just treating teeth?
Well, it was, you, you go through so much education.
Yes.
And then when you're in school, you first start off with you go through all those lectures and then you go to the lab and you
Mhm.
work on teeth and you carve teeth out of wax and all this kind of stuff. But once you get into the clinic, that's really when that's when it really don't hit you. You're working with patients. My first, just even my first treatment plan when with my very first patient, the patient was like, I was like so nervous because you have to present the patient to your professor. And the professor was sitting there hounding me, and I was like so nervous. And my patient was actually encouraging me. She was actually supporting me. And so it was just that connection, just the working with people, just being in the clinic. And it took, in the way our indoctrination, you just don't get in there and just start working on the patient's teeth. You have to do a lot of workup to even get to that point before you can even get in their mouth and start working on their teeth. So it's so you learn that right away as soon as you get in the clinic that you are working with people and with patients, and so not just working on their teeth.
Yes. And I'm happy you had a patient who was encouraging you, who was for you and ready to to cheer for you.
That's right.
So, the theme for today's conversation is a lifetime of care. So, from your perspective, what does that phrase truly mean for dentists, patients, and communities?
Well, the thing about dentistry is that, everybody knows that they're supposed to go in for their 6 months checkup and things like that. One of the things with dentistry has been, I'd say, a leader on in professions is we really we really try to do the preventive aspect to try to get people to a level of health and have it so we try to get it so that they don't get so much dental disease. And so that's what the fluoride in the drinking water. That's a community-wide thing. We have it in the toothpaste. And also, once it was discovered that fluoride in the right quantity helps prevent dental cavities, um, we did that initiative to try to get it introduced in the drinking water. Um, and so, that's actually almost trying to put ourselves out of business by preventing cavities in the first place. We, but so we do a lot of things, and then trying to, have people to come in for their 6 months checkup to have their teeth cleaned to try to prevent gum disease and things like that. And um, so basically, we don't want people to have a lot of disease. We do things to try to keep it so they don't have to keep coming in for those awful visits. And it's nice to just come in for the checkups and, basically have to have your teeth cleaned and not have to have a whole lot of other work done. And so, as people progress through the different ages, I mean, there's, other, all kind of other things they may face with, as you start getting other medical health problems. Sometimes those show up in the mouth. And so we still, and sometimes the things that certain diseases might manifest in the mouth before they even know they have that disease throughout the rest of their body. So that's why we do encourage people to continue to come in for those regular checkups, so we can just kind of trying to help prevent other problems from developing, or if we notice things, get them to see their physician or anything like that. And so it is a lifetime of learning and helping and working with your patient to just try to keep everything as a maintenance level versus letting things progress to getting worse.
Yeah. You know what? As you are talking, I'm laughing at myself because no, it is. It is true because there are times when, you keep on for 6 months, then you go, oh, I can't, you are busy. You can't come, and you keep on postponing. But as you are talking, I'm just listening. I said, you know what? I think many of us, we end up paying more money at the end. Because why? Because we are not even people with insurance, we are not going to our dentist only 6 months so that they can check us and they can see things that are timely, right? And that decay can go very fast. I had a tooth where I went in and it went on so fast because I took a month and prolonged it, right? They could have seen it much faster. And it ended up actually costing me out of my pocket about $650. That's before anything else. Yeah? Because I didn't go.
Thank you, Dr. Jackson. You just brought some reflection.
No, it's true because now I'm looking at myself and you hit it on the nail. I think from now onwards, you really opened up my eyes where you say, this is the lifetime. We are not trying to get money from you, we're trying to maintain you so that you don't pay more money. Yeah, that's what I heard from what you said. So thank you.
That's right.
I truly appreciate it. Yeah. So let's move to another thing. It's about trust, right? You open our mouths, and sometimes what you see in those mouths is something different. So really, when we go to the dentist, it's also really trust become an essential part, not from your point of view, but also from a point of view of the patient, because trust is essential in healthcare. So how do you build a strong, trusting relationship with patients, especially those who may have fear or anxiety about coming to the dentist and be seen?
Okay. Well, you definitely have to be somebody that can relate to your patient. You have to actually care about your patient too. They're just not that crown that you're going to do today to make however much money. You have to talk to your patient. You have to listen. Definitely have to listen to them, and you also have to be able to read their body language. So if a patient comes in and they're like this and they don't want to open their mouth or whatever, that patient is tense. And so you've got to try to get them to relax with your conversing with that patient. Um, um, Basically, building trust, you have to show empathy to the patient, that you care about them, and that will definitely help build that patient up. And you also have to be confident in yourself, and that you're going to be able to help them. And so you do have to portray that you are there to help take care of them, and you're going to try to make it as comfortable for them as possible, and that you're not in a hurry. And you run on a schedule, and that's the one hard thing with this profession, is because you run on a schedule. But that patient that's in your chair, they need to feel that they are the focus of what you're thinking about today. You definitely can't be looking over in the other room. Oh, I got to get over there while you're over here trying to work with this patient. You can't do things like that. So you have to have that patient feel like, that they're important, and that you care about them, and you're there to help them.
Yeah. You know what? I can talk about the dentist that I have, Dr. Carl. He is really patient. And even when he's touching your mouth, you don't feel that. He's very gentle. Mm-hmm. I went in once for the tooth, which I didn't think was going to take 2 hours. It took I thought it was just going to take 30 minutes out. It took 2.5 hours. And as you said, you can't be looking at the back to see what's next.
Yeah.
And you know what? That's when you appreciate that patient relationship. The office is just an awesome. If you came here, I'll introduce you. If you needed a dentist, I'll take you there. Yeah. So thank you. Yeah. Oh, hi. Okay. So I'll ask the next one as well because I see that. Are you okay there? Okay. I think we were frozen somehow. All right.
Now, after years of practice, I'm sure certain patient stories stay with you forever. And I'm sure you have several stories to share, but can you share just one memorable experience with a patient that reminded you why your work matters?
Oh, there's like so many, but there was oh I worked again in a community clinic, and we had patients from all over, and that came to us. And I remember there was this one girl. She was a teenager, and I don't know, a few years back when they were talking about the Guatemalan immigrants coming over in busloads or whatever. It was during that era. Um, and she was actually one of the immigrants that came over, and she had a really horrible story of what happened to her. And we also worked through a translator because she spoke a different language, and I was working with the translator. But um, and so she couldn't, she didn't speak English. And so trying to communicate, trying to figure out what her problem, she was there for an emergency, um, trying to communicate with her. Her mouth was actually on fire, and basically it was just because of what happened to her, her escaping the condition she was in and getting over here. It wasn't even the cab. Everybody was thinking, oh, it's probably she did have some cavities, but that wasn't the source of her pain. It was more of what we call trench mouth. It's like she just hadn't had any oral health care, and her gums were just on fire. And just to try to touch her gums, it was so painful to her. So anyway, of course, we had the language barrier, and we also had her that she was in severe pain. And so, but to be able to learn her story, figure out what's going on with her, and getting to this is what the problem is while she's in so much pain. And so we actually did treat that. We basically had to just clean her teeth so we can get those gums healthy before we can even get in to start addressing her fillings or anything like that. But basically, we were able to work with, figure out what the problem was, go and working with the interpreter to do the communication, and then to have her feel at ease to let us take care of her. And so we were able to do something for her that day. She was in there for an emergency just because she was in so much pain. We were able to do something that day for her to address the immediate problem. And then we had her come back in a week, and it was like the difference between night and day. She was able to eat, finally get her mouth open and eat. She wasn't in, we addressed that problem, and then we were able to, start taking care of the other problems. And so, um, and so I just feel like that's just such a accumulation of so many different things. We have the language barrier, we have, trying to communicate with her, trying to make her feel at ease to let us take care of her and help her while she's in so much pain, and let her know that we are not going to hurt her. We are going to try to help her. And so I just, when she came back that next week and she was smiling and she was not in pain, you just felt so good that you got it right, that you were able to help her, and now she can come back and we can continue the work we were doing.
Wow. So it really took like a team, right?
Oh, definitely.
It
Yes.
really took like a team to really accomplish that. And I think, you know what, for me, when you say when she came back, she had a smile.
Hmm.
And that smile is very important because the first thing you took care of is that pain, so that she was able to now open her mouth and you can do more work.
Right.
And that takes a lot of, I think for me, it's also empathy. And when you talk about the language that you had to work through an interpreter, I could see that it was very challenging, because even for me, there are times when the dentist say open, sometimes I'm closing. I speak English, right? Right? Because sometimes you, until it's wide, then you have to open up. Wide, then you try to open wide. So I can see the challenge that was going on, and how you managed. I don't know. But God bless you guys for what you did, because these are the little things that make your work uh, so rewarding, because you can do things that may seem impossible.
Right.
Yes, it also ties into the question that you just responded to earlier.
Mm-hmm.
People come in with fear,
Mm-hmm.
anxiety, which may pose as barriers,
Mm-hmm.
language,
Mm-hmm.
but navigating that, I'm sure you built trust in that
Correct.
relationship with that
Correct.
patient.
Correct. Yeah.
Mhm.
And you know what? The other thing that we don't, I think people, from what you said, is, yeah, you built trust, but you built more customers, because what will happen? That person becomes now your sales agent to go and talk about how that clinic saved her, how that clinic helped her as a human being, not a person who came on the bus load that they were talking about, but a person who came for help.
Mhm.
Yeah.
So, yeah, it's marvelous. And the impact of your work, at least today, you can go look back and say, you know what, those are the achievements that will never go on the resume, but the achievements that will go down with you, and you find fulfillment in what you have done in your job. And that is what legacy is all about. Yeah. We know that dentistry requires technical precision, but also we talked about empathy, but we talked about patience, and especially in the question that you answered before, or the story you told us about the patient that you cared for. It required both, a combination of both empathy and patience. But how do you balance clinical excellence? Because there are times when our teeth, when they go, they are so either fragile or they are just so black, right, that you have to deal with. So how do you balance between clinical excellence with compassion care in your daily practice?
Well,
And stay sane. That's the only thing.
like again, like when I was first starting out,
Mhm,
um, I I definitely wasn't very confident
mhm.
in a lot of things that I did, because it's like, you go out of school and then you're like, okay, you're on your own. And so, but so it's still the practice of dentistry. You learn from your patients every day, and so and the thing is always trying to improve your skills. Um, and there's been times again where I might have not been as confident there. I'll tell you another little story of the time where I felt like I wasn't as confident in doing a certain procedure. And so I was going to refer this patient out to get it done. And the patient told me, no. If you don't do it, I am not going to have it done. And so, and this was actually a lesion that I was suspecting that it could be malignant, it could be cancerous,
Mhm.
and I wanted to refer, and she wasn't going to get it biopsied somewhere else, so I did do it, and it did come back. It was malignant, so I'm kind of glad I did do it, um, and I'm kind of and the thing was school really never when I was in school never really taught us how to talk to a patient if you find something bad like that. And so I um so I did have her. I was like, I'm not going to call her on the phone, call her. I'm going to have her come in for an appointment, and we're going to talk about talk about this and what needs to happen and things like that. But still, I think it's the whole thing of um, having the patients feel comfortable coming to you, knowing that you care about them, that actually they want to push you to excel. She knew I didn't feel comfortable doing the procedure, and not because I didn't really know what I was doing. It was just, I mean, I just never did it before, for one thing, in that particular spot, and so I was just a little worried about it. But you know, for her to tell me she wasn't going to get it done unless I did it. I just felt like, I mean, it gave me a lot of confidence to, okay, I'm going to go ahead and do it then because I felt she needed to have it done. And we had a good everything was a good outcome. It turned out well. She did get treatment and we got it early enough that she was able to get treatment and things like that. So I think it's the partnership between you and your patient. Um, you know, you have to again show that you care about them, and they will also support you as well.
Wow. Trust.
Yeah, yeah. That
Yeah.
that ties in very well into
Mhm.
the next question. Um, many professionals say mentorship shaped their careers. Now, with what you learned in school and from your experiences and what you learned along the way, how important is mentoring young dentists? And what lessons do you try to pass on to the next generation?
Well, you know what? I'll tell you another part of my career. We didn't really talk about it much. It was in my bio, but after I finished working when I retired from working with the public health service, I became adjunct faculty with the University of Minnesota because I always I always loved working with students. And part of that was because when I was in school, they didn't treat us very well. They kind of treated us like, the instructors had their degree, and you as a student, you're never going to get it. You're never going to get you're not going to make it out of here. Unfortunately, that was just the culture at that time. And so I always felt like, um, you know, that's why I kind of liked working with students, and because it was like, no, I want them to get it. I'm not going to be here forever. There's going to be somebody else that needs to be able to take my place and the other dentist's place, and we need to have good professionals. And so I always, when I worked for the government, we always had a student program. Students would come in for externships, and whatever site I worked at, I always became the person that coordinated that program, the student program, because I enjoyed working with students. And so, um, so I did. So when I finished, when I retired from the government, then I became adjunct faculty with the University of Minnesota, and I read the clinic that I worked in Wilmer, Minnesota, was the clinic that the students came in and they treated the patient, and I was of the faculty overseeing them. And so, um, so I always would try to see, the first day with the new group of students was the learning period because I would kind of learn where they are in their clinical skills. And I would always try to match the patients to their skill level. Once I found out where they were, I try to, so it would be because I wanted to have good outcomes versus a student in the middle of something and then find out, oh my, I can't do it. I don't know what I'm doing or whatever. And then they get stuck. And so I always wanted it to be a good experience for both the student and the patient. And so I did spend 11 years in my career just working with students full time.
Wow. We need people like you. We need people who are in the profession because they want to leave a legacy that's better than what they received. I've seen a lot of people who say, "Oh, I didn't get that, so why should I?" But what you just said is your goal was, although you had that discrepancy, I call it a discrepancy, where teachers who are supposed to give you, the mentor you, to coach you, and to be examples of what it is to be who you are, who you're going to become, are here and they want you to be down there. But what came out of you was, it ain't gonna be me. I'll be better than what I received. And for that, you sourced it, you executed it, you lived it, you breathed it, and you left a legacy in those students. Because either one of them would take what you've taught them and actually do the same thing that you've done to them. Others would be different, but one person will take what you taught them. And thank you, because we need legacies. We need people who can do better than what we have received from others. If you are beaten, don't say you have to beat other people. That's not what we need. We have to be better than that. And thank you for that. Wonderful. I love hearing such legacies because that's what leadership is all about. And to the students who are hearing, this person can continue to be your mentor. Those want to go into dentistry, she can be your mentor. Because at least she can teach you what, maybe not clinically, but at least give you the experience that she has had, both the good and what she executed herself. So I hope you're listening. And Sosa, she lives in Colorado. If you want a number, let us know. We'll give you her number. All right. And let's talk about dentists. Dentists often play a vital role in improving public health. In what ways can dental professions contribute to community service and help improve access to care? Because access is what is very difficult, because there are many people who want to have their teeth cleaned, but they do not have the money and they do not have access. How do you see it, since you have served both in the government and you have served both on the other side? I can say it's a private as an adjunct professor.
Well, that was one of the issues that we faced when I was in Minnesota, because and actually in one of the clinics in Michigan as well. Most of the dentists in their private practice were not taking public assistance patients. And so, because reimbursement rates are low. And and so the so the, so then that left all these patients out there who needed a dentist but didn't have one to go to. And so that's kind of where this clinic came to be is um, they got the funding together. They got some grants and built this clinic, and then they had students from the University of Minnesota come, and it was a win-win because the students got more clinical exposure, and the student and then the patients were able to actually finally get um, much needed dental care done. And so um, I would encourage people in private practice to consider seeing at least a small percentage of these patients in their practice because, they're people too. And, and they have a lot of unmet needs. And, you just can't wait for somebody else to do it or just close your eyes and just say, well, I it's not my problem. It is your problem. We are a community and so just feel like, you've got the skills to help people and then you should be in dentistry because you want to help people versus I want to make as much money as possible.
Mhm.
And so I would just consider just giving back to your community because it's your community that's supporting you as a professional as well.
Yes. I'll just maybe ask a question here, maybe if you have ever seen, because this is what I tell my son that I think when you start practicing, please make sure that you can have a community of doctors that can go and do pro bono. And I'm going to be the one who can, if I have to drive a motor thing, I'll drive it, right? So that you guys can just go and give maybe once in 2 months or so, just have for 2 hours, 4 hours, whatever, a day and do that service because you're giving to them. Do you see a lot of dentists doing those kind of work where they can come together and especially, and I'm asking this question, I have to also consider the legal aspects that sometimes you help somebody and the same person you help is the one who nails you on the back. So have you seen dentists coming together, because to do some of this work uh, and
Well,
help others?
Well, some people like to do they have the mission trips where you go overseas and
Mhm,
you can provide care to patients.
mhm,
I do, there's a lot of people there's some people that participate in those type of services.
mhm,
I know Colorado, the dental profession, they have yearly they do a sponsor clinic called the Mission of Mercy,
mhm,
and that's where they spend a weekend. It's all volunteer,
mhm,
and they pick a location and they set up with portable equipment and patients can come. They register that weekend
mhm,
and they don't have, it's free for the patients, and so dentists, that's all supported by volunteers. Dentists will volunteer, assistants will volunteer and provide care for people that are in need. And so that's something that Colorado does as an organization, a dental profession. Um, when
Wonderful.
we did have, like in my clinic, we
Mhm,
saw mostly public assistant patients, or we also had a sliding fee scale for low income patients.
mhm,
And so we did have some dentists in the community that volunteered
mhm,
to come to our clinic. Some gave us like once a month or something like that, or and some once a week or twice a month, something like that. So there are different opportunities available for volunteer if they so incline. Or again, even within their own practice, they can consider taking a small percentage of public assistance patients into their practice. And that also will help.
perfect. Wonderful. Yeah. We need that. I think whatever we can do because it's giving back. It's giving back to communities that at one time maybe paid for their taxes and we drive on those roads. So it's really helpful. Thank you for that.
Now, we all know that a career in healthcare can be very demanding. So, after many years in the field, what helped you stay passionate, motivated, and committed to your work? I'm sure upcoming dentists would like to hear that.
Well, for me, I was just really driven to these populations that I work with, public health, low income patients, patients with a lot of unmet needs, and so I just, I just felt like I need to help these patients. I need to help them. Um, One clinic that I went to was it was on a Navajo reservation, and um, um, they were trying to restaff their clinics with dentists. And so I was the first one. They had five dentists at one time, and then all the dentists ended up leaving, and so they were trying to rebuild the staff again. And so I happened to be the first one back at that was hired for the clinic when they were trying to rebuild their staff. And so going in every day, there'd be a long line of patients. I come in, there's a line of patients waiting out the door because the clinic was in a trailer. And so so it's like, okay, here's my, they're here waiting for to get services. And so um so I worked till, very hard all day long. And I had five assistants, and we just saw patients all day, just until we got everyone seen. And so they were long, very long days. I was tired by the end of the day, but I was just happy that I was able to see everyone. And so, and I was going to be there the next day. I'm always one that I was always when I hardly ever took a sick day. I had to really be like sick, like I couldn't get out of bed or something. And actually, usually I'm not even that sick. Um, I'm gonna get out of bed. I'm gonna get there. I'm gonna get to the clinic because those patients are scheduled. It's gonna be a while before they could get another appointment. So, if I'm not there and their appointment is canceled, you know, they're not getting served. And um, so I think I was always motivated because I felt that the patients needed me there to help them. And I remember there was one time where I was at a clinic with three dentists, and we all got sick. We all were sick with something. I don't know what it was. It must have gone around in the clinic. And so I still came in. The other two didn't come into work that day. But I was like, I don't feel good. I feel like I'm only at 10% of my capability, but I'm going to still come to work. And so, and that was before COVID. I mean, we wore glove, mask and everything. So, I didn't feel like I was going to give my patients sick because I wore a mask. And it wasn't during COVID. It was another time. But I still came into work, and I still tried to see patients. And there was this one person I just couldn't do it. I couldn't get it. I couldn't do it. And the patient was okay because they were like, we're just happy you tried. You were here, and you tried. And I think I ended up referring them so they could at least get it done. And there was sometimes, so then after that I was like, okay, if someone's got a infection or something, I'm gonna just write a prescription. And at least I could do that for them. If I can't treat the problem or whatever, at least I can do something for them today. And so, I felt bad that, maybe couldn't get everything done, but I said, at least I'm still doing something for them. And they know there's still somebody here for them, that they just didn't get turned down by the receptionist saying no one's here today. So,
Mhm.
so we have to reschedule. But so,
Yeah,
um,
bless
so
your
again,
heart, bless your heart. It just warms my heart when I hear that. I just
yeah. It's just the motivation that, you've got the skill, you're there to help people. And so that's what
service,
kept me going.
service above all else,
Mhm.
and that's what we are forgetting now because we want to be saved before we save others,
Mhm.
right? And I think until we can all start thinking that we are in positions, we have got the qualifications, but our qualifications are supposed to serve others.
That's right.
So that at least we can set examples for others to follow through. So truly, I truly appreciate your answers. I'm so happy to hear that. Time is not with us, and I will let Pearl ask the last question again. So, Pearl, go for it.
Maybe if you could just drop one more nugget for students or young dentists that are just beginning their journey, what advice would you give to them about building a meaningful and impactful career in dentistry?
Okay, so if it's someone that's kind of interested in dentistry, haven't really started the education process, I would recommend that they look at opportunities to try to observe in a dental office. Some dentists will let you do that. And just so you can kind of get a really good idea of what the job entails. And so, and then if you're in school already, and you've got to finish. And so, just school is hard, but you just think of it, there is going to be a light at the end of the tunnel. You're going to get that degree, and you're going to be able to help people. So, you got to jump through all the hoops that they want you to jump through. And, if you got into school, you definitely can do it. You just might have to study harder. Study hard and things like that. Because I studied hard, but it was something I was passionate about, and my goal was I'm going to get this done in 4 years, and so I'm going to do whatever it takes. Then I'm going to graduate in 4 years, and then as far as once you're out in practice, you still have to remember. I know you might have those student loans that you have to pay, but you can't you that can't be foremost on your mind. The foremost on your mind is that patient that needs your help, and you need to um, think about the patient. What do they really need? What do they want? Be able to communicate, convey to that patient that you care about them and that you're trying to provide the best service possible for them. And, once you gain their trust and respect, which you will if you again communicate with them and treat them like people versus money. Once you do gain their trust, you will have a successful practice. They'll come back, they'll refer their friends, and um, you'll be a very successful practitioner.
I think maybe what maybe before we close is today when you stand back and look in, what how do you feel?
Oh, me?
Yeah.
How do
How
I
do you
feel?
feel when you sit back and look at what you did in the last 30 something years? How do you feel? Because I'm asking this question because of what the answers that you give and the dentist you have been, as the person who serves. So how do you look back and see what you have done today?
Well, I'm very happy. I felt like when I was practicing, I took care of people, and I love helping people. I mean, even now that I'm retired, I still, I'm not practicing dentistry. I still am a part of the my organized dentistry. I don't have a license in Colorado, so it's kind of hard because it's like I can't really do anything hands-on because I'm not licensed here. I don't really want to practice because I'm a a grandmother. I babysit now, and I really enjoy taking care of my grandkids. But um, I I just feel, still feel like I want to help people. And so, my son called me the other day, because he's a track coach, and one of his athletes got injured and injured their tooth, broke a tooth while they were pole vaulting or something. And so then my son calls me because he says he tried to they called their dentist, and the dentist didn't answer. And I felt like, I wanted to jump in the car and go look at it, go look and see the problem. I'm like, I can't do it because I'm not licensed,
You
but
don't
but
like
I did give him, advice of what to tell her and things like that. So, and I'm like, I
it.
still want to help people. I like helping people.
Wonderful, wonderful. You are God sent, a dentist who saves. That's what I can say. Yeah. So thank you so much, Linda. Thank you so much for your inspirational. Thank you so much for your responses. Thank you so much for your service,
Oh, you're welcome.
for what you've done, and your heart of service, your attitude of service. Thank you.
You're welcome.
So, as we come to a close to our audience, this has been a wonderful, wonderful discussion, and you want to have dentists like Linda because they'll work for you and they'll save you. So, as you see, dentistry is a unique blend of extracting science and human connection, where technical skills meet the simple, profound act of easing another person's pain and restoring their confidence. Every diagnosis, treatment, and follow-up embodies both knowledge and empathy, as you saw reflected in Linda. We wield instruments and evidence-based techniques, but our true power lies in listening, steadiness, and the trust we build with each and every patient we touch. A lifetime of care is more than a career path. It is a promise. And Linda made that promise. It is the commitment to be present through milestones and setbacks, to help a child or an adult take their first bite without fear, or to give an anxious adult the courage to smile again, to support elders so that they can retain dignity and comfort. The continuity fosters healthier lives, families who feel supported, and neighborhoods that feel thrive because someone like Linda cares enough to show up day after day. When we save, we strengthen communities, preventative education, accessible clinics, and outreach programs. These extend oral health beyond the chair and into the schools, the shelters, and the community centers that we live in. Each small act of service compounds. Fewer emergencies, brighter futures for children, and reduce burdens on our health systems. In this way, dentists are public health leaders whose influence ripples outwards. To lead with purpose in dentistry is to marry excellence with humanity. It means mentoring the next generation, advocating for equitable care, and innovating with the humility to put people first. And Linda did that. Our science gives us tools. Our compassion gives them meaning. Together they build not just healthy mouths, but healthier, more resilient communities. And a profession that reflects the best of what we can be. And to you, Linda, kudos. And God bless you always for what you have done and the impact you've left and the legacy you have left to the community you've served. And to our audience, listen to this because you need dentists like Linda. Over to you, Pal.
What a beautiful closing. Well, thank you so much, Dr. Jackson, for such inspiring conversation around your field. And to our audience, we have learned today that leadership in this field means showing up with technical excellence and moral clarity. It means mentoring, as we heard today, advocating for access to care, and also designing programs that meet real community needs. It means treating every patient encounter as an opportunity to teach, to provide comfort, and to empower, because oral health is integral to overall well-being, as we have learned today. So we look forward to seeing you in the next episode. Thank you for joining us on this journey to elevate and inspire. Until next time, lead with purpose and grow with passion.